Good evening, everyone. I want to welcome everyone that is joining us tonight on our virtual town hall. I am Jessica Bush, aide to Supervisor Andrea Bailey of the Potomac District. Supervisor Bailey has a wonderful panel assembled tonight to discuss mental health. After a brief introduction video, the next voice you will hear will be that of the Honorable Andrea Bailey. Hola y muy buenas tardes. Quiero darle las bienvenidas a todos que nos acompañan en nuestro ayuntamiento virtual en esta noche. Mi nombre es Jessica Bush, ayudante de la supervisora Andrea Bailey del Distrito del Potomac. Supervisora Bailey tiene esta noche un panel ensamblado para hablar sobre la salud mental. Después de un breve video de introducción, la siguiente voz que escucharás será de la honorable Andrea Bailey.
Well, good evening, everyone. It's a pleasure to be here with you this evening for another round of discussions concerning our community. I am Supervisor Andrea Bailey for the Potomac Magisterial District, and I'm excited about our evening to talk about mental health. It's an exciting time to really address our health, both physically and mentally, in our communities. And so I found it was very important that we have this discussion with the subject matter experts that work and live and play in our community and care about us as well. So as we get started, I want to take this opportunity to introduce the panel for this evening. Welcome, everyone. It's a pleasure to be here with you this evening. I want to take this opportunity for you to just introduce yourselves and tell us what is it that you do here in Prince William County. I'll start with you, Ms. Fleming.
Good evening, everybody. Thank you so much for the opportunity to be here to discuss this very important topic that really needs to be brought to the forefront. My name is Kim Fleming, and I am the CEO of the David J. Cobb Foundation, but more importantly, I am a suicide loss survivor. We are a mental health awareness and suicide prevention nonprofit here in Prince William County, and it's our mission to provide resources to those in need and to their families and to shine a light for those in darkness. My journey started on October 23rd, 2015, when I found my 17-year-old son after he had died by suicide. During the many years David struggled, I myself struggled to find resources and programs in the community or in the schools to help him. So when he died, I made a promise that I would find a way to help families find the help that they need when they needed it. I am by no means a mental health professional, but I am a mom with years and years of lived experience, and I will just do whatever I can to save lives.
Thank you very much. It's a pleasure to have you with me this evening.
Thank you.
Now, next, I'm so excited about, I just told my wonderful colleague, Ms. Martinson, I finally get to have her by myself. Heather, tell us what you do and why you're with us tonight. Okay, we may be having some brief technical opportunities there. So let's move on to the next panelist. I'll move on to Vicki Johnson. Vicki, thank you for being here this evening. I think you're on mute.
Thank you so much, Supervisor Bailey, for having me. And thank you to the rest of your panel. To Prince William County, this is really an honor, and it is a timely subject. I'm Vicki Johnson. I'm a licensed clinical psychologist, and I have a private practice in Dumfries, Virginia, Vic Johns Counseling and Consulting, referred to as VJCC. And I also have a nonprofit 501c3, Soul Glow Community Mental Health Services. I'm a native of Dallas, Texas. I came to Virginia to make this my home. My husband recently retired from the Army. We decided to make this home. I'm originally from Dallas, Texas.
Wonderful. And we're so fortunate to have you away from Dallas, Texas. You're here. We're going to keep you because we need you here in this community. I'm also joined by my friend, my colleague, one that we've worked together in the community for a very long time, Delegate Elizabeth Guzman. Elizabeth, please, thank you so much for joining us.
Good evening, everyone. Thank you, County Supervisor Bailey, for inviting me tonight. I apologize, but just traffic, as always, is not being my friend tonight. I was supposed to be in my office at 6:30, but I'm here, almost there, and I said, no, I need to connect in a timely manner. So a little bit about myself. I represent the 31st District in the House of Delegates, which includes parts of Prince William and Fauquier counties. I'm a public administrator. I'm the first social worker elected to the Virginia Assembly. And I am a mom to 4 children. I am an immigrant. I'm a Latina, also the first Latina immigrant elected to the Virginia Assembly. And it is an honor. Professionally, I work for the City of Alexandria. I'm the Division Chief for Administrative Services for programs that help people with mental and intellectual disabilities, with substance abuse disorders, for senior citizens as well. I oversee a budget of $20 million with a workforce of about 200 individuals. So mental health is my passion. You know, as I said, many of us have personal stories, but I also have personal and professional stories. And it is my job in the Virginia Assembly and in the community to fight for more services so we can, you know, get rid of the stigma of mental health, where people could actually look at mental health as just a regular illness that anyone could have, that with treatment, with medicine, with therapy, we are able to cope with it. So I am excited to be here. Thank you for the invitation. And I am just really impressed by the professionalism and the talent of this panel. Thank you.
Oh, thank you so much. You be careful out there. And I thank you for the level of commitment that you have in coming with us tonight and discussing this most important subject matter. So I think we're going to wait. Oh, there. Okay, Ms. Martinson is here with us. Thank you so much for joining us. We understand technical difficulties, so please don't worry about it. Just join in the crew, and we'll get through the panel discussion, hopefully without any additional technical difficulties. But it's a part of the game right now. But we're just happy that you joined us. Please tell us what you do here in the county.
Sure. Thank you. I had a internet glitch for a second. My name's Heather Martinson. I work with Prince William County Community Services as their behavioral health wellness supervisor. And so with that, we do everything we can to prevent substance use and promote mental health, as well as prevent suicides. And so talking about mental health is my job. And so I'm just happy we're all here tonight. As someone, I've been with the county for 20 years now. And so it's always nice when we get the opportunity to talk about mental health and what we can do to help each other.
I appreciate that. Heather and I have been friends and public servants passing in the wind in different opportunities and organizations. And when I see her in a crowd, I always know that things are getting done. And so I'm glad that you're here with us this evening. And lastly, but certainly not least, my dear colleague who I simply adore, and I know he adores me too. You can tell me later, Kenny. But my dear friend, Supervisor Kenny Bodie. Kenny, thank you for joining us.
Thank you, Supervisor Bailey, for having me on this panel. Again, my name is Kenny Bodie. I am the Occoquan District Supervisor. I sit alongside my colleague on the Prince William County Board of Supervisors. Supervisor Bailey and I have talked about mental health for quite some time now. It's near and dear to my heart as well, because about 4 years ago, I lost my mom, and one of the issues that she dealt with was bipolar disorder. So mental health is something that I know that we need to tackle, and it affects all swaths of life here in the county and throughout our country. So I was honored and felt greatly very grateful when Supervisor Bailey invited me to be part of this panel. I'm really looking forward to this discussion. And a brief shout out to our friend and our esteemed colleague, Supervisor Delegate Guzman in the General Assembly, for everything she's been doing to help in this regard as well. Thank you so much.
Thank you so much. Absolutely important. It takes a team to get things done, to serve at a higher level. And so that's why I've invited this team to come on this panel to offer their expertise and solutions to our community in a broader sense. The world took us by a storm when this awful pandemic called COVID-19 came, and it became an era in our community. And so it brought about stress and fears and anxieties that most of us had never known before in a normal sense. And so it's a new disease that we were not accustomed to. It's a new disease that rested in our community and stopped the activities of our communities. And so when we talk about the public health actions that we've had to take in order to survive, like the fear and worrying about just our personal health, when you talk about having to adjust our financial responsibilities in this type of situation, that brings about a certain amount of stress that we've not experienced before, because it's something so uncertain. Changes in our eating habits, changes in our sleeping habits, and just becoming overwhelming with, even if we had chronic health conditions to begin with, how that can be exacerbated by COVID-19 and even worsen as we move into protecting our mental health conditions in a broader sense. And so this disease has been extremely overwhelming for us. And so when we talk about the disease, it partners with our mental health. And so it's equally important that not only do we do the physical things that are needed to protect ourselves, but we also protect ourselves and our families mentally. And so one of the things that I want to move into is in this discussion with this overwhelming disease that has attacked us, is when we think and we feel overwhelmed, what are some of the things that we can, or the choices that we can make to promote better health and promote the reliability of self-care? Because I don't know about you, but that's one of the things that I'm not so good at self-care. So let's start there and kind of talk about what we can do to feel better in an uncertain time like COVID-19. And I'll start with you, Vicki, if you will.
Supervisor Bailey, and to your guest and everyone who's watching, that is a very great question. What do we do about self-care? That is something that's often people feel bad about, taking care of themselves. So many times we are conditioned to take care of everyone else. We know how to be good mothers and good wives, good friends, great to our relatives and great on our jobs. But when it comes to taking care of ourselves, that is something you combine that with your mental or emotional health, and you will often find people who experience a lot of guilt about asking time for themselves. We don't know how to be selfish enough to do that. But this is that is a very good question for a great time, because as you all know, many people now are saying they wish they could just do 2020 over again. Like, we need to do this over again because it's been so stressful on so many people. And Supervisor Bailey, this is a great question as well, because I've noticed that many people who have otherwise coped well all of their lives are having difficulty now in coping with this. So what can we do? Listen, we do have to be creative in these times in getting self-care and still being careful, because these are pandemic times. So many of us are working at home. That's adding a different layer of stress, because we have school children at home, perhaps, or perhaps you're working at home with your spouse and you're sharing space. And so you're receiving the phone calls that you wouldn't otherwise receive from bill collectors, for example. One lady told me she wasn't used to having, finances, people from bill collectors to call. So I encourage people to do these things. Continue to reach out to your family and friends who are near and abroad. Do just like we're doing now. Have Zoom parties with your friends and with your families. Many families have established Facebook pages just for their family. Supervisor Bailey, and to anyone else who is listening, no matter what the weather is like, you have to get out every day and get you some fresh air. Walk around your neighborhood. And then one more thing, and then I'll let someone else talk. I have found too that because your schools are closed, your elementary schools, your middle schools, and your high schools, they have large parking lots that are almost like a mile in parameter. Those are great places to take your kids, or you just go out and walk the perimeter of the parking lots. At the schools, bring rollerblades, skates for your kids, bicycles, those types of things. So feel free to be creative without being guilty.
That's great. That's great. Thank you. Let me move over to the elected officials, because I know that stress, I can certainly say that stress is a part of what we do. It's a part of what everyone does, but there's a level of stress mentally that I've noticed that we have to manage, if you will, as we do our jobs. So what can you offer to us in terms of self-care mentally and managing the stress, levels of stress? So Kenny, I'll start with you.
Sure. Thank you for that, Supervisor Bailey. So, we have turbulent lives and turbulent times. No one could have prepared us to have our first year in office be in the midst of a global pandemic, followed by another great recession, followed by a renewed era of racial unrest, which has led to a renewed civil rights movement. It's what we signed up for, but we really didn't know that when we were taking our oath of office at the beginning of the year. So that as our context and the backdrop of what we're doing right now, what I would say is it's always important to remember that our lives need to be balanced. We can't just, we do pour our hearts and souls into these jobs, but we are well-rounded people at the same time. We have families, we have loved ones, we have folks that we should be spending time with on top of our duties. We should be taking the time to get to our great parks and open space all throughout the county. Prince William County has a lot of great parks. I live in the Lake Ridge area. We have Lake Ridge Park. I hike quite often. I go there. I go to Prince William Forest Park, which is in your district, Supervisor Bailey. I take the time for myself, and I found that has done wonders and paid dividends in terms of allowing me to recenter myself and sort of keep focus on why we're doing this, and really so we don't burn out as we continue forward.
Wonderful. I'm sorry. Delegate Guzman, one of the things that you refer to in telling us about what your day job is, what are some of the things that from a funding perspective in terms of self-care that we should look for within our county to help us with our self-care?
Wow, very good question. So it is correct. I have a full-time job because the job of a delegate is only part-time.
Yes.
So on top of that, we are parents, working virtually while assisting our children connected to a virtual world as well. And from a county perspective, I wish we could have more services that I have seen in other localities when they have to do with childcare services. So there are many. I was looking at numbers actually this morning because I participated on a women discussion on how through this pandemic, so many more women have lost their jobs compared to males. And the reason is because of the lack of resources. Many women have become, the person who have to stay home and assist their children, and many of them don't have the opportunity to telework. So they have to given up their professional lives in order to help their children to attend classes and conclude this. I'm facing reality. So with the first thing that I would say is I would like to see the county providing more services for parents, mainly those parents who don't have the luxury to stay home to with their children and they have to quit their jobs. The other thing that I would love to see is to see the county, having 70% of the population commuting outside of the county for a high paying job. I think it's an additional stressor for many people who reside in the county, where right now we're working virtually, but in real life, is that you spend on the road a lot of time, and that is time that you don't spend with your children. So I would like to see an initiative where there is a preference or prefer hiring to local individuals who work in the county, so we can just create a community where we're helping our families thrive. As far as self-care, I think it is very important. I would agree with everything that we heard. The only thing that I would add is that being an elected official, being a mom, and working full time, we need to be a structure. And when I talk about the structure and discipline with our time, that means also including in that schedule me time. And me time could be going for a walk outside or maybe going for a drive and just breathe some fresh air, that it's going to help you bring the energy that you need, that your children need to see when you get home. Because I would not lie that sometimes it's challenging. Sometimes it's frustrating when you're on the phone in a meeting or in a Zoom call trying to get your job done, and then your children lost internet connection, or they have a question about connecting to a class or printing an activity. But I will just say, create ground rules in your house as well. And I think it's an opportunity for us to also help educate our children, right? And where is a good time to interrupt mommy or daddy while they are working, and find a different way to communicate, so we respect their classroom time. Because as parents, we sometimes I crash in the background where my children are in virtual class, and they are like, "Mommy, you are just interrupting my class," and I'm like, "Oops, sorry." So create some ground rules where you are teaching your children since they are little, and be respectful, but be respected as well.
Excellent, excellent. So let's move into talking about the better part of us, our children. Um, I tell you, I I am so focused on the children in our community. We have a great school system, a great school system. But I'm also in tune to the fact that inside of that, our children feel alone sometimes. Just like us, their moods swing as well. And it's hard for them to be grounded right now because of the adjustments that they have to make as it relates to this COVID season. And so Ms. Fleming, I want to turn this over to you and explain to us what you've learned by running your organization, the things that you've learned in terms of our children, and the things that we need to be focused on in terms of helping them to manage their moods and their mood swings, and managing the balance and staying grounded during the COVID season. You're on mute. Yes, you're on mute. You're on mute.
Can you hear me
There you
now?
go.
Sorry about
Okay.
that. That's a great question. Our youth, need so much help, especially now during, this pandemic and all the stresses that they're dealing with. This pandemic is going to have a long-lasting negative effect on our youth and on everyone, for that matter, and especially with those with pre-existing mental health problems. So I think it's so important to get programs into the schools, to help these students when they get back to school, to help them deal with any stressors. One thing I would love to see is more training on signs of suicide. I know our teachers are trained, but I would love to see everybody trained. I feel that everybody that has a connection to our students should have some sort of training to recognize when a child is in distress, because not all children are going to ask for help. I know my son didn't, and I really wished if someone had maybe seen what he was going through, I might not be having this conversation right now. Things would be different. So that is really huge to me. I think, like Delegate Guzman said, there needs to be a balance. I think, kids need to be active. They need to get away from their computer screens and go outside and play and just be kids. I know, being on the screen myself, it's stressful for me. So I can't even imagine what it is like for a student. So, I think, parents just need to reach out if they need help. I mean, there's so many, nonprofits, there's so many people out here that are so willing to help. And if a parent is struggling with either daycare, or I don't know what to do with my child, or I have to work and I need help, there's so many people that they could reach out to, to help them out when they're struggling.
Started your nonprofit to support those in need. And I think that plays a big part also in our community at any level. Nonprofits are put there to support a need. And so I honor the courage that you've taken to establish your nonprofit to help our community. So we really appreciate that. I want to segue with Heather Martinson. Heather, I want you to talk about one of the needs when Ms. Fleming was mentioning about training. One of the needs that I know in the school system that we have been very much focused on, and I give kudos to our school system for opening the schools for the special needs children. Can you talk to me, Heather, about the need from a mental health perspective to keep our children and even our adult children who are suffering from autism?
Yeah, no, I think that's a great question. And, as I was talking, listening to Kim talk, who's a dear friend of mine, and thank you for calling her courageous, because she is. We, especially in these times, we all need structure, going back to talking about self-help. At the very beginning, we all need that structure and those familiar, caring faces that we all see every day. And so for a lot of our young people, that's one of the biggest struggles for them, is that learning from home is difficult because of that lack of in-person care. And, a lot of us are safer at home during COVID, just keeping our social distance. But there are some of us that are not. There are, people that are higher risk for mental illness, for domestic violence, for a whole host of other things that are at home that need extra support that they may not be getting. And so I know at Community Services, we've been working really hard with the school system's mental health team to try to figure out how to connect with families that need that extra support. Because honestly, referrals are down. A lot of the referrals for mental health supports and domestic violence and CPS claims came from the school system. And so we have kiddos that are at home that may not be super safe or in the best learning environments that need extra support. And so I know we at Community Services are doing the best we can. I know the school systems are doing the best they can to reach out and try to reconnect with those kids and families that need our extra support.
Great. Thank you so much. One of the things, there was a terminology that was utilized early on in the during the panel discussion that I want us to really kind of talk about in a more deeper sense. There is a great stigma around mental health continually. And so I want us to talk about why is there stigma, and the mental health conditions and needs have arisen so greatly during COVID. Why is there still a stigma with mental health? And I'll go to Delegate Guzman initially for that.
Oh, thank you, Supervisor Bailey. Very good question. I think that I have seen this on the field, and I will have to say that it's more in communities of color, and it's because we have a reluctance to admit that just mental health could be like any other illness. So we have to, even when I have to deal with families and these children are acting up in school, and then parents are concerned, they're trying to discipline their children different ways. But then when their the primary care doctors are telling them, could you consider, have an outpatient therapy or be assessed or be diagnosed? It's like, no, my son does not need that, or my daughter does not need that. What they did is better discipline. So I think it has to do first to provide that information and go to communities where they are. And in the Latinx community, I will say that we have to use information like via radio or maybe via TV, or we can actually go to the community and explain to them what it means, because it's hard. Many people, even when you have to have these parent meetings and parents are coming and they said, well, could you consider taking your son to a psychologist or your daughter to a psychologist or talking to a licensed therapist? The answer is like, no, my child is fine. It's just that he needs to do a better job listening. So I think that we just have to share more resources with the community, try to share with them information in the best way that they will absorb it, and making this a priority as well. It's not something that you procrastinate, because many people don't know that when your child is in the school age, and for example, we're talking about ADHD, and in elementary school, he could get away with it, or she could get away with it, because there was additional resources. But then in middle school, it could be the same way. But once you go into high school, and if your child has ADHD, and it's not only attention disorder or a learning disability, but it's actually impulsive and aggressive, it could get into trouble, and your child could actually go to jail. So if that person does not have an IP documented in their file, it could end up being used against that child. And that is how important this is. But we need to talk more about, I think, as elected officials and organizations that are in that community. I would love to partner with you, County Supervisor Bailey, County Supervisor Body, and with the nonprofits in that area to provide more resources, to provide educational resources as well. And I want to commend you, Supervisor Bailey, for having that introduction in both languages, and to recognize that there are, many residents in the area who do not speak the language and would love to receive this information.
I thank you so much for the compliment. Let me just ask you to explain something. Well, I'm going to broach the question to Mrs. Johnson next, but Delegate Guzman, explain the terminology Latinx, please.
Well, The X includes for the members of the LGBTQ community, which is another stigma also within the Latino community. You know, the term X means that we are also inclusive of our brothers and sisters from the LGBTQ community. That it's a problem that we have as well. We see many teenagers and young boys that when they belong to any of these communities, just because they don't have the support systems at home, they end up being kicked out of their homes or in shelters, and we're trying to help by changing that terminology and being inclusive of them as well.
Thank you. Thank you so much. I'm one on words and I am one on educating. And so that is a new terminology that has come up in our community, and we need to educate on that terminology. So Mrs. Johnson, why is there a stigma?
Yes, this goes way back, Supervisor Bailey. I really commend you for your questions because, again, this is very, very important. It goes way back to how we've treated people for many years who have mental illnesses. It wasn't very long ago that we deinstitutionalized people with mental illness. Many times they were in facilities and in locked facilities and basically medicated and over medicated, and nobody was giving people education about the mental illness. Many mental illnesses can be explained very simply in just understanding what a person's brain chemistry is like. It is cultural. It is the way many people grow up and what we think about being weak or being strong. It has a lot to do with your spiritual beliefs and what you think the Bible says about mental illness. People often quote scriptures to me, Supervisor Bailey, about what the Bible says about mental illness, and it is their interpretation. And so it does bring on a lot of shame and guilt, and people hide in fear from anxiety, from depression, when there are millions of people each day who could be diagnosed with something. Not to say they received that diagnosis, but they could. So it is fear of being judged, fear of being misunderstood. It is how we have talked in our families for years about things. Don't go see a psychologist. Don't tell other people your business. And specifically, I see a lot of Christian people and their beliefs with, you pray about it, and if Jesus don't take it away, well, that's just something you have to live with. And so that stigma of that diagnosis is one thing. And then, Supervisor Bailey, I won't get into it, but then the medication is a whole different conversation as well.
We're going there. We're going to go there. We're going to go there next. I wanted to bring Supervisor Bodie in on this one, because one of the things that I've certainly noticed in our community, the high level of stress with males in our community, in terms of just being able to manage it and being stigmatized that way. What's your observation about that?
Sure, thank you for that, Supervisor Bailey, and I agree with that. There is a to go back to the terminology, a stigma and a connotation associated with males, especially Black males, and how we deal with stress, how we deal with anger, how we deal with life's hardships. And to go back to something that we worked on this year as supervisors is the co-responder unit for the Prince William PD and Community Services, which pairs a police officer unit with a mental health specialist to react to mental health calls. And why that's so important, why that ties into your question, Rosa Bailey, is far too often we have this idea that if someone's going through some sort of mental health crisis, that there's something fundamentally wrong with them, or they have sort of moral health failing on their part. when in reality, just like your body gets sick, your mind and your spirit and your mental faculty become sick as well. And that can be simply also a response to trauma. And as people of color, especially as men of color who grow up in a society that honestly, we grow up villainized by society in some ways, or there's a long history of trauma when it comes to racism in our society, one of the ways in which trauma manifests itself is through mental health issues. So as we deal with these issues, we have to come up with not only ways to react to these issues that don't end up with incarceration or death with a co-responder unit, like I just mentioned, but also preventative measures to really talk in our communities about how do we deal with stress, how do we deal with trauma, how do we really look at not only addressing the wounds after they happen, but healing and making sure that in our youth, especially our young male youth, that we don't traumatize them in some of the ways that we ourselves have been traumatized over the years.
Excellent, excellent. Thank you, Supervisor Bodie. You use the terminology talk. And so I'm gonna let me move in that direction, because one of the things that I noticed, I was watching a news report the other night, and it was in reference to caregivers taking care of their elderly parents, and the news report was on elderly parents and how they feel alone, but when they're communicated to, when they are talked to, when they have interaction, then their mental health is broadened and it arises. And so let's talk about communication, because COVID has caused us to be a little more isolated, a little more closed in into specific areas, not the normal areas that we usually participate in. Let's talk about communication and how do we bridge the gap in communication to broaden the world in our minds to survive COVID-19. So I think I'm going to pass that on to Heather, if you would please talk to us about communications and how we broaden our minds in this era of COVID.
Thank you, Supervisor Bailey, for that question. And before I answer that one, I'm going to bounce back to Supervisor Bodie and him talking about trauma. And just give a plug for our trauma-informed care communities network here in Prince William. We meet every month. We've been doing some great trainings. I just looked today. We have trained over 4,000 community members and school system staff about trauma-informed care and adverse childhood experiences. And so there are people within our school system and our community that can speak to that trauma. And COVID-19 is a traumatic experience for a lot of people, and the coronavirus, because we're not set up as people, as humans, to have this prolonged stress that a lot of people are experiencing. And so our brains are changing, we're reacting differently. And so when we talk about communications, my biggest go-to is just reaching out to people. We were just, you just mentioned older people. I have parents that are in Philadelphia and Florida. I call them more now than I ever have. I love them, but I call them more now than I ever have because I can't go see them. And I know that they're in higher risk, populations. And when I ask the question, how are you doing? It's a greater pause, because if I get oh, I'm okay, the follow-up question is, what does that look like? Like, what have you done the last couple of days? And just taking the time to really ask some, how are you doing questions? What can I do for you? How are you feeling? It opens those lines of communications more than we probably ever could do. Someone mentioned kind of Zoom meetings and family meetings, doing those things, but having to be really honest about how we're feeling. I know I have friends that ask me, and I'm like, I'm tired. Like,
Yeah. Yeah.
I'm sitting at home, and we could be doing this face to face. Just being really honest and recognizing that other people are also most likely feeling the way that you are, and just giving people space to talk. Some of the best conversations I've had in the last 7 months are at the grocery store, because that seems to be the only place I go. And so I talk to the cashier, like, how are you doing? And she's like, well, and I'm like, no, really. And she's like, I hear half her life story, but that's being a human and connecting. And that's what we need when we can't really do that much right now.
Yeah. Yeah. Just connecting is so very important. I think before COVID started, because we're so active and we're going in different directions and we have these robust calendars, we forgot how to connect to one another.
Right.
And if there's anything, I think there's several things that are positive that have come out of COVID. But I think that's one of the things in terms of the connectivity. We are forced to connect. As I was saying about Heather, I see her in different places and we're at different meetings and I wave and she waves, but we're connecting now. And that's very important to understand the connectivity. But I promised Mrs. Johnson that I was going to go back to medications. And so I want to talk about medications, and I'll start with you, Ms. Fleming, in terms of medications. What's your opinion right now about the opioid epidemic that we're experiencing, not just in our country, but also in our county? What's your opinion about that?
The opioid epidemic. That is a great but tough question. Actually may have to, I hate to do this, refer to Heather, because Heather is way more familiar with the whole opioid epidemic than I am. So I'm going to refer to her if she's okay with that.
I was jumping in. I was throwing a life raft. No.
She's going to go to opioid question. So
that's fine.
We are seeing an uptick in overdoses in the nation, but also in locally. Just this weekend, and this is, my biggest issue is that right now we're seeing a lot of counterfeit pills, where people are trying to buy pills from people that they think are one thing and they're definitely another, and are overdosing. But we're also seeing, just this past weekend, there was a spike at our local hospitals with people that came into the ER after they were revived, claiming they were just smoking marijuana, and they had been revived with Narcan. And Narcan only works on opioids to reverse an overdose. So that whatever they thought they were using was not exactly what it was. And so, we at Community Services do our Revive trainings, where we go through how to recognize and respond to opioid overdoses. And then we're able to give out free Narcan, which is the only way to reverse those overdoses. It's a nasal spray. It's quick. But we have training set up through the rest of the year and going into 2021. So there's definitely been an increase in opioid overdoses. The other increase we've seen is with alcohol-related overdoses at our local emergency rooms. And so people are definitely turning and using drugs and alcohol more in the last couple months than we've seen in a while. And that's, for a couple different reasons. But when we go back to mental health, when people start losing hope, they start looking for other alternatives to cope with things. So we're definitely seeing an uptick. I definitely want to just, warn everyone to be aware of that. And it's not just, we were talking about older people. Our older people are at home, possibly by themselves. And so they may have some opioids from pain management or surgeries. And so we also need to talk to them about taking their medication regularly but responsibly.
Need to think of other remedies or other techniques. And so, Mrs. Johnson, I am going to come back to you in terms of when you talk about the opioid attack, if you will, on different people. But I also want you to offer what are some other natural remedies in reverse of just focusing on the opioid opportunity.
Supervisor Bailey, of course, there are natural remedies that people use. For example, exercise has been shown to act as an antidepressant. Getting out every day, 30 minutes, 1 hour, it really does help you to manage your stress, your anxiety, and depression. I do know that people are using melatonin to help them sleep, and other natural health food store. They're watching their diets, what they eat. Many people are cutting out meat out of their diet. They say it makes them feel a lot better when they don't eat meat or dairy. So there are a lot of different natural things that people are doing to help. But if I could say, though, now, Supervisor Bailey, we do look at mental health professionals. We look at frequency, we look at duration. How long has somebody been depressed? Somebody asked the question, what exactly does that look like? These are things that concern us. So we know that therapy helps, even with someone with an opioid addiction. Some pain is somewhere that they're using the opioids for, and they are highly addictive. For some, they may start out as manic pain, and then it's out of control. It gets out of control. It's unmanageable for them. But many people are afraid to take psychotropic medications to help them manage anxiety or depression as well. They're ashamed to admit that they need that. So one last thing, and I don't want to skate around the question. We do know that therapy helps. The research shows that therapy helps. Talk therapy. It brings the outcomes here. We do know that medication, it helps, because some people say, I don't have time to go see a therapist. Doc, just give me my medication, I'll be okay. And we do know the reason is that it brings the outcomes here, but together you get greater outcomes, therapy and medication. So I don't want people to be ashamed that they have to take medication. And one last thing, Supervisor Bailey, this is crucial because we live inside the Beltway. Many people have high-level security clearances. Mm-hmm. And so this keeps them from coming in seeking services as well. And this keeps them from taking medication as well, because they know when it comes to a security clearance, they could be asked those questions. Mm-hmm. And so this brings us back to fear, shame, guilt, and stigma, as you talked about.
Yeah. We appreciate you just walking us through that. That's very important, because we need to bring this relevant issue to the forefront. So I've lost my screen. Did I lose my screen? But I wanted to close out with this, simply this. I'd like for you to offer tangible resources to the community that can help to heal a soul, give a person hope, and providing a balance, if you will, a foundation for mental health. So I'll start with you, Ms. Fleming. You're on mute.
Mute.
There you go. You're good. Mhm.
Yeah. The best resources that I can come up with for someone to reach out to is definitely the CSB. They are a huge resource here in this community. There are also helplines for those who are struggling. ACTS and NAMI both have helplines that are here local. And there are so many nonprofits that you could reach out to. Reach out to me, my organization. I will be more than happy to either help you myself or connect you with any of the amazing
Your
organizations here in our
is?
community. The David J. Cobb Foundation.
If
And I
you
can
would,
put it in the
please,
chat
yes.
if that helps.
And I wanted you to talk about nonprofits, and you did an excellent job in doing so. So, Supervisor Bodie, resources from the county.
Yes, ma'am. Yeah, thank you so much, Supervisor Bailey, for hosting this. One of the biggest resources I would offer, of course, on top of our own offices, yes, we are good conduits to connecting our constituents with the resources they need for mental health, substance abuse, all sorts of other issues, is the intensive in-home New Horizons program that, we funded this year through the Board of County Supervisors. What that does is it really goes into the home and heals the whole home in terms of how the parents are dealing with mental health, but especially the children. As we talked about before, with this COVID era and the kids of school age not being able to see their friends, having to deal with virtual learning, all the stresses of being a teenager or a young child on top of everything else, and not necessarily having the guidance and the referrers and the guardians they would have in school. There's a lot of issues in the home that parents may be afraid to talk about, or the students themselves may be dealing with that they don't really know to go to. So these in-home intensive care specialists will go into the home, see the whole home as it is, and really help the parents and the kids sort of work through their issues, whether it's mental health, substance abuse, addiction, whatever it is. They will go in and take a very deep look and a holistic view on how to heal that home in a holistic sort of way.
Wonderful. We had a wonderful presentation last week in our board meeting from Ms. Lisa Madron, who is the director for the New Horizon Group. And so we're really proud of that. And that is a resource. Thank you for mentioning that. Heather Martinson, please share with us resources. I know you have a list of, but if you can give us a short list and a phone number, we'll be happy.
Well, let me see if I can try something real fast. I was going to try to share my screen, but I'm not sure if that's going to work. But I have a couple that we talk about all the time. So the first thing is, Kim mentioned it, Community Services has our crisis intervention program. And so they respond on a 24-hour basis to the community. If you are kind of in the Manassas side of the county, it is 703-792-7800. In Woodbridge, it's 703-792-4900. We also have the crisis intervention team. So if someone calls 911, you can ask, and if you yourself or someone in the house is having a mental health emergency, you can ask for a crisis intervention team officer to come to that response, and they are uniquely and wonderfully trained to respond to mental health emergencies. There is a new, and it just kind of rolled out today, I think, the Smart 911, where you can go to smart911.com and fill out your profile. And so if someone in your home has unique needs, whether it's mental, physical, whatever, you can fill out the form. And so when you call 911, it will kind of pre-populate your information to the responders. And so that, I think, is a great innovation. Supervisor Bodie mentioned the co-responder program that should be rolling out in the next couple months, where a CSB therapist is paired with the police. There's also CR2, and that you can just Google CR, the letter 2, the number, and that's a 24-hour rapid crisis response for people 21 and younger, and it's to no cost. It's grant funded, and so they will come and intervene in any sort of mental health crisis with people under 21. And then I think Kim mentioned our wonderful hotlines, ACTS, NAMI. The Department of Behavioral Health has the new Virginia COPES hotline, which is a warm line. And then we have also our Regional Suicide Prevention Alliance, which is, you can just Google Northern Virginia Prevention Alliance, and we have some great resources on that website. And so I think I may have covered them all.
Excellent, excellent. So, Delegate Guzman, tell us about the special bill that you sponsored and got passed in the legislature that helps our county to address mental health. You are an advocate, you are an activist. You mentioned at first how mental health is your passion, and you've put your words into action in the General Assembly. Just give us an overview, please, about how you've done that.
Oh, okay. Thank you. Well, I would start by saying that I made part of a team of my campaign to hire more school counselors for public schools, not only for high schools, but also for middle schools and elementary schools. When I got into the office, the caseload for a school counselor, who is a licensed therapist, was 750 students in elementary school. For middle school was 625, and for high schools was 375. So I made that a theme of my campaign. I definitely think that school counselors were asking them for a license, mental health license, and they can, put it to work. But if they are not just challenged with the amount of cases that they have to deal with, and it's important to recognize, supervisor, that when we're dealing with the children with mental health needs, we are just not looking at the child. We're looking at the environment, right? We have to teach the parents to become a support system for their children. We have to have meetings with the teachers, with the family members. So I'm excited to share that we finally are on the way to reduce those caseloads, not only for elementary school, middle school, and high school, to 250 students. I think next on the line is going to be psychologists as well, as they have to test, and many of them are working in 3 different schools, and that's something that we need as well. And so as social workers as well, as the licensed therapists with the social workers and psychologists work great at supporting each other and supporting the family. The other thing I would say is that many of the teachers were not required in the past with mental health first aid training. For many of us who are in this panel today, that is something that we have to do for our profession, but none of the teachers were required to have this training. And I think it's important because as a teacher, you have to identify and know how to respond to the need of a child of mental health, and it has to be in different capacities. Not always a child is going to have an IEP and is going to have a one-on-one. Many of them, because of they have support systems at home, they are able to succeed in the classroom, but they are going to need an extra help and extra attention. Teachers need to be more understanding of the situation. So for that reason, starting this school year, all of the teachers now need to go through mental health first aid. And finally, I would say that during this special session, we met to deal with criminal justice reform, law enforcement reform, and COVID-19 response resources. So I would say that in the Department of Criminal Justice Services, the board didn't have any input from a mental health professional. And now, per my bill, not only the communities of color will have a voice at the table, but also a mental health specialist who's going to help all of the law enforcement, not only those who sign up for to be on the crisis intervention team, to provide them with resources to know how to identify in the community when the citizens are dealing with a mental health episode, but also to self-assess themselves because many times they're exposed to trauma and they need to know how to deal with it, and they need to have someone that they could call and find these resources. And I will conclude with there are many resources for mental health, but I think one of the ones that we are proud about is the Marcos Alert. And with the Marcos Alert, we will be able to identify those individuals who are coming through an emergency but are coming through a mental health episode. And the last tip to all of the listeners and viewers here, we talk about calling 911. So please don't forget to disclose that information. I'm seeing that in my district when sometimes we have one of our children, when he's a teenager, is having a temper tantrum or an outburst. And we are not disclosing that information to the police when we're making that phone call to 911. So you are not, breaching that patient's confidentiality only by saying that my son or my daughter have a mental health diagnosis. And finally, if your child is already receiving treatment and you know that it's going to turn 18 soon, and as a parent you won't be able to control that process, please make sure that you have a transition plan so your child could continue with their therapy and with medicine as well.
Fortunately, and I have been so proud to have all of you on the screen tonight just to talk about this very important issue, mental health. Mental health, as it partners with COVID-19, is a little scary and uncertain, but there is hope. There is hope in all that we can do to heal the land here in our county. And so with all the leaders that we have on the screen tonight, I say goodnight to you, but I thank you most of all for all the work that you do in our county. Thank you so much and good night.